The following portion of Daytime Tri-Cities is sponsored by ETSU Health. Today we begin a brand new segment here on Daytime Tri-Cities with our friends from ETSU Health. We're calling it Meet Your Provider. And right now I want to introduce you to Dr. Jodi Gage. And Dr. Gage, thank you so much for taking some time with us today.
Absolutely. Thank you for having me.
Let's talk about your background, your educational background, because a lot of it was done right here at the Quillen College of Medicine.
Absolutely. Apparently I bleed blue and gold, so I literally did everything at ETSU. I got my undergraduate degree here. I graduated from the Quillen College of Medicine in '98 and went on to do my pediatric residency training here.
And tell everybody what specialty are you in?
So I am a general pediatrician. I work in the outpatient clinic in ETSU Health.
What led you to pediatrics?
Oh, absolutely the kids. I have the best job ever. Most people look at me and say, how in the world do you do what you do every day? And I look back and I think, I get to play with kids all day. This isn't work. This is fun. I can't think of a better job.
You know, you were telling me about why you got into pediatrics. Were there any other areas of study that you might have gotten into?
Well, they always tell us to keep an open mind during medical school when we hit our third year clinical rotations.
Right.
And so I tried to do that. And I was actually getting kind of nervous because I did peds late in my third year and nothing had really clicked for me. And that very first day of my pediatric rotation, I came home and my husband said that I was just nonstop bubbly talking about my day. And he looked at me and he said, I think you found your mothership. So,
so you boarded the mothership and took off.
I boarded the mothership and I didn't turn back.
Right. I could see the smile on your face. And after 21 years of doing this, do you still find it easy to go into work every day?
Absolutely. Like I said before, working with kids is not a job to me.
Yes.
It's fun. I truly enjoy seeing the kids, but also the parents and the relationships that I establish and develop with our families over the years, watching them grow.
And let's talk about, that aspect of it, because sometimes you kid them at a very young age and then they kind of age out on you. Do you love seeing that progression?
Absolutely. I don't think that there is a greater honor that a parent could bestow on a pediatrician to entrust them with the care of their child, one of their most precious, things in the world. And then you become a part of their family, really, as that child grows and navigating all the different challenges that no matter what stage of life they're in, whether it's the newborn stage or the toddler or elementary school, and then you hit the challenges of adolescence.
Right.
And it's almost like I'm part of that family, and when they get to those college years and they decide to, it's time to leave the pediatrician and move on to adult doctor, it's bittersweet.
Right.
I've shed tears before when patients on that last visit, they're not going to see me anymore.
That shows a lot of compassion on your part. After all of these years of practice, I'm sure you've seen things that you were doing before when you first started, and things have changed over the years. What are some of the big changes in pediatrics that you can talk about over the years?
For the most part, pediatrics really hasn't changed all that much. There are recommendations that come out and change. One of the biggest ones is probably with regards to food allergies.
Right.
And how we used to say years ago to wait to introduce foods that were had a higher incidence of allergic potential to them, and now they actually recommend introducing them as young as 6 months of age. That has been shown to decrease the incidence of food allergy. So that's a big one that's changed during my time.
And when you come in every day, talk us through a normal day for you.
So like I said, I see patients in the outpatient clinic setting. So I have well visits on my schedule, ranging anywhere from that initial newborn visit right out of the hospital all the way up to an 18-year-old who's getting ready to go off to college and needing those last vaccines before they head out. I do sports physicals, so all those in between, in addition to acute visits and seeing the sick kiddos that come in with a fever or a sore throat or the stomach bug that need to be seen.
And you were talking off camera just a moment ago. We're just coming, we're kind of coming out of the COVID pandemic now. There were some special challenges that all doctors faced during this time.
Absolutely. We really had to reevaluate how we saw our sick kids at our clinic, and just changing how we brought them even into the clinic and bringing them through the back door so that our sick kiddos could still receive care
Right.
and be seen by a physician and have those ears looked at and those throats looked at and lungs listened to, but not risk our healthy children who are waiting in the well waiting room.
For those parents and those children that are out there right now that may be looking for a physician, sell yourself. Talk to us about why people should come to ETSU Health, first of all, and specifically for you, for your care.
So for our clinic in general, the
Yes.
pediatric clinic at ETSU Health, we are the only pediatric clinic in the area that has an integrated behavioral health team on site every day of the week. So we have a child psychologist and a social worker there at all times to help navigate a lot of those, especially now since the pandemic and the awareness of mental health issues with our kids has been brought to the forefront of medicine. We have that as part of our clinic, which really sets us apart from others in the area. And for me personally, if you want a pediatrician who loves seeing kids and is truly 100% invested in your child and their growth and development and well-being, then I'm your person.
Can't do better than that. Doctor, thank you so much for taking some time with us and being our very first Meet Your Provider. We appreciate that. Being our first provider on Meet Your Provider, we appreciate that. Dr. Jodi Gage, our first ever Meet Your Provider here with ETSU Health. The preceding portion of Daytime Tri-Cities was sponsored by ETSU Health.